So without much ado, we'll get started. Our first panelist is going to be Parul Samani, who has been with us earlier, and she was rated so highly for her story that she shared with us last November. And this time round, we're going to have two other panelists with us, Meera Rao, who's also been with us earlier, and she's also a wellness patron, and of course, Ajit Dera, all very accomplished entrepreneurs, investors, corporate professionals in their own right. But they have their own amazing stories to tell you, and we intend to make this session very interactive. So please start putting your questions in the chat box. As we start progressing, and of course, we'll also have quite a few health heroes actually in the participants. We'll see more of them, and we'll recognize some of them as well. So let's get started, and over to you, Parul, and thanks to all the panelists for making their time on a Father's Day and joining us. Thank you, and over to you, Parul.
Thank you. I would say my health hero story actually began back in 2014. I was just 31 years old at the time, and at an inflection point in my career, I had left management consulting after about 9 years in the space and had recently joined a startup and made that transition into the startup world. And I had found out just 2 weeks actually after I left my consulting job that I was pregnant with my second daughter. And yet I still early in my pregnancy joined the startup. And I was actually at a 38-week ultrasound appointment when I felt a lump. And I immediately went to my OBGYN to express my concerns and was told that it's likely nothing to worry about because I was only 31, I was pregnant, and that it was most likely a clogged milk duct. But we insisted on further examination, and she referred us for an ultrasound appointment after all. But we never actually made it to that ultrasound and biopsy because 2 days later, my water broke and my newborn arrived 2 weeks early. So there was plenty to be distracted by, and if having a C-section and a newborn wasn't enough, my daughter was actually born with complications, and we had to be ambulance transported to a different hospital so she could be in the acute NICU. But even then, we kept the lump top of mind, and my husband wheeled me from the NICU to the neighboring breast clinic for an ultrasound and biopsy. And even there, the breast surgeon actually said it's likely nothing to worry about, the tissue feels soft, and it's probably a clogged milk duct. Luckily, a few days later, my daughter was discharged with a clean bill of health, and we were able to go home. And it was just that same weekend, the weekend of Father's Day, on her 1-week birthday, that I got the call from the breast surgeon saying the mass is malignant after all, and I had stage 2 triple negative breast cancer and would require a bilateral mastectomy, chemotherapy, and breast reconstruction. And so in the 1 year that followed, I had 10 rounds of chemotherapy and 4 surgeries. And I'm so thankful that we had advocated for ourselves and insisted on that ultrasound and biopsy when we did. And the reason that we felt empowered to make that insistence is because 2 years prior, in 2012, I had actually gotten genetic testing done. And I had found out then that I carry a mutation in my BRCA1 gene that dramatically increases my risk for both breast and ovarian cancer. And while that information at the time was incredibly difficult to hear, it was also greatly empowering and proved to be so when 2 years later, I had the power of that information and the power of the information of my risk to actually advocate for myself. And it would have been very easy to dismiss the lump, believe it was a clogged milk duct, because in fact, after my delivery and when the milk came in, I actually couldn't even feel the lump anymore. And had I waited a year after I stopped nursing until I felt that lump again, my prognosis would have been entirely different. But that genetic information both helped me detect my cancer at an earlier, more treatable stage, but then also informed my treatment and made sure I had the chemotherapy and surgical procedures that would be most effective for that diagnosis. And this past fall, I actually celebrated my 5-year anniversary of being cancer-free.
Thank you, Parul. We still have participants coming in. I know it's a Father's Day, so a lot of people are finishing off or getting into something. So I want to tell you that I can see a lot of participants among us who are health heroes, and I would just like to acknowledge them because we want to make this session as interactive as possible. I have, one of our, participants who is in stage 3 cancer, and he has been regularly following us, and I'll recognize him, and he'll definitely tell you a little bit about his story. I'm sure there are lots to learn from each other. So we have Adolfo there. Of course, we have Naren Bakshi, who's joined from India early morning. Thanks, Naren. He's been the pioneer of advocating, health hero. And we have come a long way. I'll tell you the story about that later today. We have Seema Giri, who's been there right from the outset. Thanks, Seema, for being with us. So we'll acknowledge all these health heroes, and there are many more coming in. So this is going to be very, very exciting. And Parul will get back to you with the questions. But thank you once again for the quick, outline of your experience, what you've undergone. And I would now request Ajit. You can unmute yourself, Ajit, and tell us, your story and, how, you have also, spent some time, it's COVID, because, at the end of the day, we want to hear from health heroes how they are, grappling with their own lives and challenges in this lockdown situation. So over to you, Ajit.
Thank you, Som. My name is Ajit Diora. I'm 63 years old. I've been a very ambitious entrepreneur, you may say. Never really wanted to work for anybody. Only worked for somebody because I wanted to get my green card. But as soon as I got my green card, I launched into my entrepreneurial career. And the sad part about the entrepreneurial career is it's a drug. You get so busy, so focused on being successful, you completely ignore your health. And that's what happened to me. Luckily, I was able to sell my company. It was 1998. And I realized I was thoroughly unfit. I couldn't stand for more than a few minutes. I had to sit down all the time, had to look for a chair. I was 194, 195 pounds on a 5'9" frame. So I was thoroughly obese. Luckily, I had the time, and I don't know what motivated me, but something motivated me to do something about it, right? So I started by saying, at least at a minimum, I should be able to stand for 10 minutes, 15 minutes, 20 minutes, right? So I started working out with an elliptical and increased it every day. And within 3 months, I was able to stand for many, many hours, right? So I said, wow, that's nice. Simple workout for an hour or so a day can give me that much benefit. I need to pursue it even further, right? Then I took the challenge of my weight. At that time, I'm not a big drinker, but I used to drink, on social occasions and things like that. And I said, maybe I need to stop drinking. So I stopped drinking for about 5 years. And I brought my weight down to about 170, 175. That made me even more happy, right? Then I was at a social gathering and somebody said, have you thought of yoga? It'll make your body flexible. So I joined yoga. The point I'm trying to make is I made health my priority. And anytime and every time somebody made a suggestion that would positively help my health situation, I pursued it, right? Not knowing whether it would actually help me or not. And what I found by this trial and error method is I continue to adopt and make it part of my lifestyle, things that help me and weeded out stuff that didn't help me, right? So life was pretty good. Then all of a sudden, I had an attack of migraine. I was driving down one day on Stevenson Boulevard in Fremont towards 880. And while I was driving, I got this migraine attack. And I really thought I was going to hit into a lot of cars. I just blindly slowed my car to the right, hit a pavement, slammed on the brakes. And luckily, nothing happened to me. My car got dented, but nothing happened to me, right? So I didn't know what to do. And since I was doing this yoga, I talked to my yoga teacher. This is 2005, by the way. And I told him, this is what happened to me. What do you recommend? He said, Ajit, have you tried drinking water every morning? He said, just try it. What do you have to lose? Try it. And he said, if you can consume about a liter and a half, the first thing every morning, it's going to do wonders for you. So I started drinking water. I could drink 1 glass, then 2 glasses, then 3 glasses. Anyway, I brought it all the way to a liter and a quarter, liter and a half in a period of 3 to 4 months. And the last 15 years, I'm glad to report, I haven't had a single migraine attack. So that's done wonders for me, right? Then as time progressed, we do have, I don't know if it is genetic or not, because I do have one sibling who has a hearing problem. And I started developing a hearing problem in my left ear. And I still have the hearing problem, by the way. It's not like it's gone, it's still there. But then again, I went to my yoga teacher. I said, hey, I have this problem. Do you recommend something? He said, have you tried Brahmari Pranayam? Brahmari Pranayam is just a way of breathing with your ears closed. So I started trying that, and I do that 3-4 times a week. I had an 80% hearing loss in my left ear at one point in time. Because of this pranayam that I've been doing, my hearing loss now is maybe about 60%. So there's an improvement. The point is there's an improvement, right? The point I'm trying to make here is that combination of a desire to feel good, discipline, not being a burden on anybody else for your own good, I think are contributing factors that have made a difference to me. And I'm a big advocate of that. So what I tell people in general is every human body is different. Every human body reacts different to different stimuli. And I advocate, if somebody is making a suggestion, try it out, especially if you know there's nothing to lose. And if it helps you, make it part of your lifestyle. If it doesn't help you, throw it out and look for the next idea to pursue. And that's my story.
Thank you, Ajit. There's so much that was going on, and this so many creative things that you did. So we'll definitely bring on our doctor panel as well to tell us what they think about what you did and what is it that possibly you can continue or do better. So we'll wait till that time. But I know Meera, our other health hero, she has been following your instructions, and she's been doing a lot of water consumption, right, Meera? So why don't we hear your story now? Unmute yourself, and over to you, Meera.
Sure. I had the privilege of listening to Ajit a few months ago at a Health Heroes event, and I really liked the story about the water. So I read about it a little bit, and I've now been drinking about 4 glasses of water every morning, which has helped reduce the acid reflux, and it also helps me with my hiking, because I guess the better the muscles are hydrated, the better for hiking. So just to give you a little bit of my background, I've been in finance, working for high-tech companies right here in Silicon Valley. And I've been the CFO of several companies, and I retired as the CFO as Monolithic Power Systems, which is a public semiconductor analog company. And I'm currently on the board of Rambus. So my story is I was always reasonably active, thought I ate pretty well, Yeah, I had a little more weight around my stomach than I would like, but I felt I was pretty fit. Then I started getting these bouts of, I started losing my words, if you will. Like I'd start a phrase and I wouldn't remember how to complete it. And then it started getting worse. Start saying, I ate an apple, and I couldn't remember the word for apple or bread or whatever it was, basic stuff, nothing new. And it was the same thing even in my mother tongue. Then I started getting to the point where I'd start saying something and then I couldn't remember what the heck I was trying to say. So it was progressively getting worse. And every time I went to my GP, my gynecologist, they'd all say, yeah, as women get to menopause or nearing menopause, this happens. Housewives are happy with it because they don't notice. It's just you professionals. You get all uptight about it. Just relax. But I just kept feeling this wasn't right. So I kept looking for a solution. And I was luckily referred to Dr. Naras Bhatt. And he said, let's get a complete baseline. So I got a blood test done by Boston Heart Group. I got a coronary heart scan, coronary artery scan rather, a carotid artery scan, a GI map test, which is a complete test of all my gut, to say what's a good bacteria, bad bacteria. I got a sleep apnea study, an ultrasound of my liver. And the result was basically, and he also had me tested to see if I carried the gene for Alzheimer's, which thankfully I don't have. But then it turned out my cholesterol was very, very high, and most of it is my own body producing it, not what I ate. And I had very little calcification in my arteries, but my soft plaque was off the charts. And that meant basically what I was figuring out as a cognitive and verbal decline was basically my carotid artery was getting blocked with soft plaque, and it was restricting the blood supply to the brain. And all this vagueness with words and difficulties with words and phrases was just the way it was manifesting itself. We also found that I had sleep apnea, and I never snored, so I didn't think I had sleep apnea, but I had the kind where you choke and you don't have air going in, which could also have been a precursor to a heart attack. I was not a diabetic. My A1C levels were very normal, but my insulin resistance levels were very high, which meant I was on a path both for heart attack and as well as diabetes in the near term. So the many things that I did at that point to hack my health was I went on intermittent fasting, 16 hours no food, 8 hours of food, but I only eat as much as I would have in those 8 hours. I don't compensate for the 16 hours. A keto diet, which is high fat, moderate protein, and very little of carbs. I started taking fish oil to reduce my cholesterol instead of taking statins. I cut down on my gluten, obviously. And then I got an oral device to help cut out the sleep apnea, something like a mouth guard. I started taking resistant starch to help my gut flora so that there's more of the healthy stuff and less of the bad stuff. And everything put together, basically, by doing all this, and then I started hiking. I hike at least 2 to 3 times a week. And I take bulletproof coffee, which also helps me. So as a result of all this, I don't have a problem with my words. That whole problem just went away. I've lost a lot of abdominal fat. I lost about 12 pounds, but almost all of it came from the abdominal area. My metrics are all much better. And one of the biggest things that I did was gratitude for the life I'd had and the journey I've had so far, the opportunities in career, the friends and family, the ability to get control of my health. And of course, right now, I'm also grateful for having this opportunity to share my story.
Thank you so much, Meera. Meera, we are also glad to have Dr. Naras Bhatt, who has been interacting with you. So we'll bring him a little later. Let's go ahead with another round. And I'll also be vigilant about the participants putting their questions. I would request all participants to do that. So I would combine two questions together, just for the sake of time. And, we'll go in rounds with Parul, Ajit, and Mira yourself. So could you, narrate the transformation that you've undergone as a person? Because that's something which is very, very significant for our participants to connect. What is this transformation, and what are some of the high and low points of this transformation? If you could share with our participants. So let's start with Parul.
Yes, I would say that my experience has been highly transformative for me, and it's been both on the professional and the personal front. So, professionally, prior to my diagnosis, like I shared, I had been focused on management consulting and was working for a startup in the consumer retail space. And, after my treatment and when I returned to work, it felt much more important to me to be spending my time working in an industry that I felt more passionate about and more mission driven in its purpose. And I came across a organization called Color Genomics, whose mission at the time was to democratize access to genetic testing for hereditary cancers. And so it effectively felt like this mission that had found me. And I was incredibly passionate about the work that they were doing, given that the role genetic information had had in me detecting my own hereditary cancer. And so I shifted professionally to focusing on healthcare, and I joined Color to lead their global B2B and B2B2C marketing team. And through that role, had the opportunity to more broadly share my own personal journey and the role genetic information had played in my life at healthcare conferences and other venues like that. And as time went on, I realized that this work of experience sharing that I had been doing on the side, either through Stanford, where my treatment had occurred, sharing my story more as a perspective of a patient and survivorship and the role of mindset, or through Color in regards to the role of genetic information, I realized that that experience sharing is actually what I'm most passionate about. And I shifted my entire professional track to now being a champion of health, resilience, and a positive mindset, and spend my entire time focusing on inspirational speaking and patient advocacy around these points. And so on the professional side, it's been extremely transformative. And on the personal transformation side, I think we don't realize how much resilience we have until it's truly tested. And the journey that I went through helped me recognize my own resilience and helped me also over the years connect the dots of what type of behavior helped me strengthen my own personal resilience. And I now seek to share those learnings and actionable steps with others so that they can sort of leverage the power of positivity in their own lives as well. You had asked some of the high and low points of this journey and of this transformation. And, I guess starting with the low point is that when you put yourself out there, which I have been very happy to do and have been a very open book, both during my treatment through blogging, my journey real time, and then in the years since the experience sharing that I've done, you also become a figure that others want to connect to when they themselves know of someone going through a difficult time. And I love that they do that and am happy to help them. But it is sad to hear how many people, and especially young people in their 30s, also just having had their children, are increasingly being diagnosed with cancer as well. And so just the exposure to that I previously didn't have, has been sad to see, but I'm just so thankful I'm in a position to actually be able to help these individuals, and also recognizing that it's very challenging navigating the healthcare system. And so any advice that I can provide to help them do that, I'm very thankful for. In terms of the high point, what I would say is there have been a number of silver linings that have emerged from my own diagnosis and treatment. And that's why I've actually named the work that I do now Silver Linings, because it's not anything I could have expected. 5-6 years ago, there's a direct link to my father's health being a silver lining and his hearing being restored after being misdiagnosed for 25 plus years. And there's a direct link to saving my mother's life by knowing the genetic information that I had learned as the first member of my family, and then proactively making sure that my mother got tested and took proactive steps as well. And these are all experiences that didn't just happen. Like when people talk about silver linings, they talk about finding silver linings. And that to me feels more like a side effect of something that just happens as a result of something good. And what I'd like to advocate is the importance of creating your own silver linings. Because when I look back at my diagnosis and the 5-6 years, of silver linings that have emerged, it's not like something bad happened and then I did nothing and then something good happened. There was a lot of intention and learning from experiences and being a patient advocate for my father and for my mother that was learned through my own experience that then created these beautiful silver linings for their own health.
Thanks,
and so
Parul.
that's incredibly high point.
Yeah, thanks, Parul. So we'll come back to you. There are many more questions popping up in the chat box, so we have lots of questions. And I know that you had tremendous outreach in terms of your blog, which is read by people from more than 80 countries. So that's just fantastic what you've done. Very quickly, we have our doctors as well. We want to hear from them, their perspective, because, a lot of our doctors who are wellness doctors who believe in lifestyle and dietary practices feel that Health Heroes could be really empowering for the community. I will hear about their perspective. But before we do that, very quickly, we can have 1 minute from you, Meera, and 1 minute from you, Ajit. The transformative journey that you have undergone, high and low, very quickly from you. So Ajit, let's hear it from you first, and then Meera.
In my case, I've been lucky. Overall, I've had good health. I just wanted to be more fit. And the thing I learned is if you're disciplined about your pursuit to be healthy, anything can be achieved. The outcome of all of this for me, I can summarize it in 2 words, I suppose, or 2 sentences. I sleep really well. When I go to bed, I don't hear anything. So that's a gift that every man, I suppose, craves for. And the 2 is, if you talk to my friends, most of them or all of them will tell you, I'm always in a good mood. And the combination of the 2, I believe, has done wonders for me. And I hope to stick to that regiment, I suppose, till as long as I'm on planet Earth, right?
Right. Great. Thank you. Thank you, Ajit. Why don't we do this? Meera, we'll hold on to you for a while because we'll pair you with Dr. Naresh Bhatt because he's here. So let's hear Dr. Sanjay Agarwal. Since you talked about sleep, he has a sleep clinic, and we've all been talking about optimal sleep. And what's your perception about the stories that you heard so far, and why you think this whole Health Hero concept and this whole Health Hero project that ICC Crack the Wellness Code is pursuing, that's going to really help the community. Your perception, you're leading the Health Hero project. So good to hear from you, Sanjay. Yeah.
Hi, everybody. Oh, wow. Wonderful stories. Meera, Ajit, Parul, thank you for sharing your wonderful stories. Very powerful, very good. And Som, just to answer your question, sleep is very important. The 3 things which are important to keep you healthy are good sleep, which is healthy, and good diet, and of course, exercise. So both Parul and Ajit and Meera, all 3 of you have noted that sleep is an important part of your well-being, and glad you're able to do that, which is good. Ajit, I would like to sleep healthy too. That's nice, man. That's very good. So these stories are the one which incite us to achieve same for our own health challenges. And this is what Health Hero Project is all about. I just wanted you to understand, all of you, hearers, listeners out there, that, you need to understand and acknowledge that the information and knowledge we share, all these presenters have shared with you, while they have demonstrated positive results for the population in general, it should not be undertaken without your consulting a licensed physician. Make sure that you talk to somebody before you implement them. Now, over the past 2 years of my association with the organization, I've seen it grow exponentially and mature under the auspices of the excellent leadership, including Som, Naren, Raj, and everybody. It's a well-recognized entity now by itself, not just an extension of the wonderful ICC which we know of, and has made appreciable impact in the community it serves. So we have had a lot of lives we touched over the last 2 months itself. Som was telling me that almost 70,000 people had logged in and got benefit out of it. So this is the goal, which we wanted to improve the overall wellness of the community members while various tested or novel approaches we can take. And Som has done so many different ways we can reach out to the community. We have provided the resources, the lead, and be a guide and a mentor to those who are awake enough to get better, and to awaken those who are still asleep. So that's where this whole concept is brought in. Now, the Health Heroes itself is a unique initiative to impact our own community. It's for those members who are ready to adopt wellness best practices, which we talk about, or we bring up those speakers those who have, performed well in various aspects, be it calligraphy, or be it heartfulness, be it mindfulness, be it healthy eating, healthy cooking, or even laughter yoga. So many different practices. And we bring in these leaders, just like these 3 wonderful speakers today, who are going to do the mentoring and dedicated coaching sessions. So the Health Heroes have done it for themselves, as you heard them. They have remained focused and disciplined, as Ajit mentioned just now, on achieving their own goals. And they are the source of inspirations and motivation for a healthy change among all of us. Most of them collaborate with physicians and practitioners as applicable, as you heard them all, and to have a meaningful recovery for themselves, which all of these are scientifically validated and evidence-based. They act as role models to disseminate the knowledge, and they also mentor others who look upon them. So in a short time, each Health Hero can reach out to almost hundreds of people by exponential growth and by role playing. So here at CWC, or at the Health Hero Project, we aim to transform the health of all the community members through various tools and platforms, be it, just picking up a cell phone, for example, or use any of the social medias which you are so comfortable with, and has the potential to continue to expand and touch many more lives.
So, Dr. Sanjay Agarwal,
yes, sir.
As you know, that we are planning to launch the app-based mentoring, and we'll also conduct a poll today with the participants. So we are on the march. But I'm dying to hear Dr. Pankaj Vij, co-founder and the chief architect of Crack the Wellness Code.
Awesome.
He's an author and of Turbo Metabolism, and he's now going on to his 2nd, 3rd, and 4th, and and many more other activities apart from being a TEDx speaker now. Dr. Vij, we heard a lot of interesting stories, and there has been focus on diet and even water intake, which really did miracle for Ajit. So would like to hear your perspective on Health Hero and how you yourself is a Health Hero at the end of the day, because you Sanjay, all of you, because you really strive to maintain and do what you say, right, in terms of diet and healthcare practices. So over to you, and your take on Health Hero, your take on the stories that we heard so far. Thank you.
Thank you. Hello, everybody. Yeah, good to see you all. Hi, Sanjay, Som, Ajit, Meera, Parul. Thank you for your inspiring stories. Now, Health Hero program is probably the most robust and important part of what we do at Crack the Wellness Code, because this is about peer-to-peer sharing and learning. And really, you guys are the experts in the room. We're not the experts to give information. You're the experts who've actually had the experience yourself. And it's so inspiring to hear your stories, very different approach right? Different approaches to diet. Meera, I heard you talk about what sounded like a high-fat, low-carb, ketogenic type of diet. And Parul has a fascinating story. I heard your story before when you spoke at the women's event that we did last year in the fall. But what stands out to me is the attitude, right? The attitude of taking charge of the situation and not feeling like, oh my God, why did this happen to me? I'm a victim, poor me. But instead, all three of you have that in common, where you said, you know, let me figure this out, and I have to be my own advocate to get the best information and not depend on somebody else as the authority or the source of that information, or to depend on somebody else to be watching out for your best interest. You're watching out for your own best interest. You found out what the best approach is. And this may not be something that's even available in conventional medicine. You had to go to several different doctors, look at different approaches, come up with something that, you know, maybe isn't even accepted in mainstream medicine. So that's what comes out that in common for all three of you, is that attitude of go get it, let's get that information. I'm going to take charge of the situation and make the problem better for myself. The second thing that jumps out is optimism, right? Again, it's not about why did this happen to me? Oh my God, you know, I can't recover, but I can recover. I'm going to figure this out and I'm going to solve this problem. And the third thing, which was really inspiring and encouraging, based on what I heard, it validates the work that we've been doing for the last 2 years, and some of us even longer, that lifestyle is the key to health. You're figuring out what is the best diet for yourself, which is an individual choice. It could be different for me, what's different from Som, it's different for Parul, right? But the importance of sleep, the importance of connecting to other people. Parul, you've got thousands of people that you're connected with, that you're helping, but in turn, you're getting helped by helping them too. So it's a two-way street. When you're connected with other people and you support them, you get their support back. And you know, this has become so evident in this time of COVID-19. And Ajit talked about mood, that he's always in a positive mood. His friends notice that he's, you know, always happy. I don't know how someone can be always happy, but you can certainly be in a positive, uplifting state of mind, even when things might not be going your way. So those are some of the things that are jumping out for me. I know Dr. Bhatt is on the line as well, and would love to hear his perspective. I'm really fascinated by this idea of genetic testing and what genomics and gut microbiomics has to offer. I know he does a lot of work with that. Some of it is not part of mainstream medicine yet, but we are already starting to see people benefiting, and it's very encouraging to hear that. So I'll stop there so that we can hear more from you guys. You're the experts, you're the heroes. This is your show, and thank you for sharing and for the inspiration.
That's wonderful, Dr. Vij. Thanks so much for your great exposition. And it also boosts lots of confidence in what we are doing at Crack the Wellness Code. So before we do a pairing with Meera and Dr. Naresh Bhatt, I would once again like to acknowledge that there are 7 health heroes with us in the participant, and one of them is in hospital, quarantined, and he's struggling with a very, very severe challenge. And he would also be talking to us. I just checked with him, and he is close to 80, and he would like to talk to us and share his journey. So it's going to be really a delight to hear so many inspiring people and learn from them. Seema Giri did an international launch of her book with a lot of stories, interesting. A book that you may all like to read. Seema, please stay on. We're going to have you on video, and so Mr. Naren Bakshi. We're going to be having Adolfo, Indu Agarwal, Doug Emis. We have a lot of health heroes with us, and we really want to acknowledge them, bring them on video. So stay on. And we also have Dr. Rajiv Doshi from Stanford. He's also going to make an interesting announcement to you about cholesterol reducing pill, which is plant-based, okay, first of its kind. They're doing a clinical study, and he's also inviting the community members. The focus is on South Asians and the community at large for treating high cholesterol cases. So Rajiv will also come and tell us a little bit about what's going on with this study and how you could participate. So let me now put Dr. Naresh Bhatt on video, and very quickly, a minute from you, Meera, unmute yourself and just tell your transformation that you've gone as a person, highs and lows, and let Dr. Naresh Bhatt chime in. Yeah.
So what's been fantastic is that obviously I eat way less than I used to, but I have a lot more energy. My mind feels like, I never thought it was sleepy, but it feels like it's so much more alert, like it's woken up. I always joke, it's my third eye that's been open. So that part of it, and having the words back, having the memory back, all that has been just fabulous. So I'm just loving this journey, and eternally grateful to Dr. Naresh Bhatt for having pointed me out and mentored me along this journey.
Yeah, Dr. Bhatt, how did you meet Meera, and what was the story?
Well, Meera came to me, as for an integrative approach for her challenges. And what we did with her is first did an evaluation, look at the presence of a plaque disease, which I will explain what it is. And second, look at her microbiome and how her gut dysbiosis is the fundamental underpinning of all of her health challenges. So as far as the plaque diseases, we did a carotid ultrasound that showed plaque, and we did a heart scan that showed plaque. And all of this plaque disease, which is atherosclerosis, hypertension, and all of these is fundamentally an inflammatory disease and is reversible. And then once you work on it and reverse it, you can prevent the events like a stroke or heart attack and so forth. That's where we started. Now, to look at her gut microbiome, we did a stool analysis called GI map. And in this stool analysis, we look at the several things. One, dysbiosis, which is imbalance. For those of you who don't know much about it, what we looked at is three aspects of the resilience of your gut biome. One is the keystone bacteria, which is like Akkermansia and so forth, just to name a couple. And then second is the diversity, what kind of diversity you have. The third is the resilience after you take an antibiotic or get sick or stress. How you resilient, how you come back and bounce back upon it. Like Parul said, the resilience at the gut level, not only gut level, at the gut biome level. So we did that, and then we put her on three aspects of the modulation: prebiotic, probiotic, and postbiotic. Prebiotic started with the food, making her eat right, that is less of the processed food, which has a lot of carb, but very little of, yeah?
Out of time, so if you could just quickly give us the essence, because
finally what happened is, the result is we reversed from bottom up from the gut biome, inflammation, and then the organ that is affected by this dysbiosis. So today, what she has learned, not only what she has learned to teach what she learned. And that is how to start your healing from the center, that from your gut. So in summary, she is an exemplary patient. Of course, many of our doctors didn't agree. When doctors disagree, the patients makes a decision, and that's what Meera did. And that is why she is a health hero.
So one thing that I like to add is that, in ICC Crack the Wellness Code, a lot of doctors are very actively involved in actually recommending health heroes. There are patients who are willing and able and, want to really reach out to the community and tell their stories, and they're recommended by some of our doctors. And we do this doctor-patient pairing as well. where, it's not just the patient, the health hero talking about themselves, but also doctors endorsing them. So together, this combo really, really helps the community at large to connect, get inspired, and the mission of ICC Crack the Wellness Code is educate, inspire, empower, and impact. So we educate through conferences and webinars like this. And then, of course, health heroes are the inspiration and some of our wellness doctors. And we empower with support groups. So one thing I wanted to also announce is that we're also going to have support group for health heroes. But that's a different story. We can talk about it later. So let me request, Dr. Kamal Gunsagar. Kamalji, can you unmute yourself? Okay, we'll wait till he comes on there. I would also like to hear Seema Giri. Seema, I'm putting you on video. And could you tell us a little bit about your journey and the book that you launched recently?
Yes, hi, Som. Thank you for calling me to speak. I have just launched a book called Break Free to Stand in Your Power. It's a compilation anthology with 17 co-authors. And they all share their journey of overcoming a major life obstacle and how they were able to create their own, the life that they wanted in the way they wanted to live. And we just had on 17th an international virtual book launch where we had 20 speakers, 17 authors, and 3 performances on there. It was actually a marathon celebration. It was supposed to be 13 hours, but people were so engaged. We went on for 15 hours, and then there was an after party, and finally I had to end it. It was really wonderful, Som. It was a most amazing experience. And we had we covered over 24 time zones, and we had at least 15,000 views that were that people were watching on big screen TVs and families together. It was an amazing experience.
Fantastic. So let me just call upon Adolfo, who's in stage 3. A little bit, a minute about your story, Adolfo, because that will resonate very well with what Parul has been saying. So Adolfo, over to you for...
and I apologize, my videos doesn't seem to be working.
Doesn't matter, just talk. Yeah, doesn't matter.
So quickly, so just to correct you, I am stage 4, actually. I've been in stage 4 going on my 10th year. Originally diagnosed with renal cell carcinoma. And lastly, last year I had a little mass in my brain. So I have overcome all that, but I wanted to just echo what some of the panelists have said about attitude. I started to live life with my first diagnosis, and it's been attitude, change of lifestyle. I had to actually, change relationships. I've done many changes, and I'm embarking on, I want to start a nonprofit as I hit my 10-year anniversary of surviving. Just to make it short. I mean, I have so much more to say.
But it's good. I know you join all our Saturday sessions. Mm-hmm. You are most welcome. We absolutely, it's a delight, interacting with you and hearing your stories and what you're undergoing. I know you're very active with the patient network in San Francisco. We are planning to launch a cancer cell, Parul, with some oncologists, people like yourself, Parul, and people who are fighting this battle every day. More about that later, but that's something that we certainly have on the agenda. Over to you, Mr. Naren Bakshi, who's got up early in the morning to join us from Jaipur. You have started talking about Health Hero right at the outset, and I'm sure you're happy to see what's going on here. Would like to hear from you, Naren.
So let me make an appeal to you, a very important appeal. The important thing that I've noticed is that the biggest help, even beyond all of our wonderful doctors, is when people hear inspiring stories, because you can get great information, vetted information, but they need inspiration to get started. So my appeal to you is collectively, if we can find this health hero thing so empowering that thousands and thousands of people listen. When they listen, they get inspired. I saw that in person yesterday when we launched a wellness movement in India. It got really big attention because the person, Premlata Sand, who is a cancer survivor for 20 years, she was there. She was not only there, she said, I created a foundation, and she announced her seed money to make it happen. Now that story went everywhere, Today Times of India. We had never ever thought that we'll have 2,200 registrations. Probably end up with 20,000.
Naren, thanks to some of our health heroes who have actually become wellness patron in terms of, they believe in the cause and they're helping this wellness movement to grow. So thanks to those health heroes who have been contributing.
Not only that, I'm also thankful to Dr. Sanjay Agarwal and a number of you who have come forward to make it happen. But my request is, let's find a way to accelerate, exponentially grow this part.
But very quickly, we would like to hear Indu Agarwal, who's also a health hero. She's been in the corporate world. A quick 1 minute from you, Indu. What transformation you have undergone, and what's been your journey? Very quickly. Over to
I
you.
would say the transformation is from pain to healing. And I have been in the corporate world as an engineering manager for many years, but I was always getting one or the other pain. And I came to the point where I decided that I wanted to claim my own healing power. So PCP for me became a personal care power. And I started my own investigation as to how do I take care of my sciatica pain. And it happened that just with that investigation came a lot of energetic healing that I did for myself. And I also started learning mindfulness at work. I started teaching Awake at Intel. And since then, I changed my careers. Now I am in mindfulness business as well as in energy healing. I've taken care of so many of my own health problems, and it just gives me joy and a lot of passion if I can help other people get on their own healing path.
And thanks to you for starting a group on energy, and we're certainly going to work closely in putting that together into the wellness support group mode. So I think you had about 10 sessions already.
Yes.
So that's a great move. That's definitely helped to escalate the wellness movement. Over to you, Doug.
Just one thing I wanted to say, that when Seema was talking about her book, I'm one of the co-authors.
Yes, you are. Yes. Congratulations. And I'm sure you're very glad to see where it is going.
And so much.
Thanks to Seema.
We became #1 international bestseller.
Yeah, I've been reading those. Yeah, I got the book already. Yeah. Very quickly, for the sake of time, I would request Rajiv Doshi to talk about the Stanford clinical study that's been done. Rajiv, over to you. You are now on the video. So if you could just spend a minute, I think people can get in touch with you. We'll put the word out. But what is the study about? And yeah.
Okay, hi everyone. My name is Raj Doshi. So I'm an adjunct professor at Stanford, and my focus at Stanford is mostly on medical technology innovation. But I'm here to talk to you a little bit about a company that I started in a study that we're currently doing at Stanford. So this is for patients who have elevated cholesterol who do not yet qualify for statins. And the product itself is it's basically a plant-based alternative for people who want to use wellness to try to see if they can reduce their cholesterol levels. So the study's run through SATI, which is a clinic at Stanford focused on preventive cardiology. And I will put the number. It looks like Som, you put the screenshot there.
Yeah, it's already there. Yeah.
Yeah, but for those who are interested, please feel free to contact the email address there or the phone number. And thanks again for all the inspiring stories.
So yes, Parul, last word. The punchline, whatever you say.
Yeah, my final words would be that today is the day to own your health, and it's incredibly important to be your own patient advocate for both yourself and for your family members, and to face whatever challenges might come your way with the power of positivity and resilience, because you are stronger than you think.
Thank you. Ajit?
Yeah, like Parul said, it's never too late. Own your health. It's not difficult at all. It's actually very easy. Once you get started, people will start noticing it, praising you for what you've achieved, and that will motivate you to even do more for yourself. So do it. Like they say, just do it.
Oh, that's inspiring. Yes, Meera.
Is so we South Asians have a track record of being very career driven. My point is that's great, but also take some time to figure out where you are, get a baseline on your health, figure out what your problems are, and get on top of it before it destroys your life. You can make amazing difference by going for just changes in lifestyle and natural cures. So my ideal is go ahead and make sure you have great balance in your lives.
So thank you, everybody. This is certainly going to be a very inspiring video. We definitely going to make sure that there are others who benefit out of this rich deliberation we had today. I wished we had more time for the Q&A, but we wanted to restrict to 1 hour and we gone by 10 minutes. But I think still we have been able to manage time well. There's a lot of things going on today. So thank you so much.